Friends, I am Dr. Sachin MUTHA. Today let us study some of the topics from psychiatric division. For this, we have to study in the psychiatric division. We have to study the major mental illness, then how to examine a mental impaired patient, what is schizophrenia, what are the types of schizophrenia, the complication of schizophrenia, what is neuroepileptic malignant syndrome, what is the treatment of psychotic patient. So let us start one by one. For the classification, that is major mental impaired patient or the major mental illness, what are the different types we have to study. For this I have made a mnemonic, that is MAO. M for major disorder, for A that is anxiety disorder, and for O that is others. For the major disorder, there is again I have made a mnemonic, that is Bhima Shankar, that is BMS. For B, that is bipolar mood disorder. For M, that is major depressive disorder, and for S, that is schizophrenia. Then after M, that is A, anxiety disorder. In anxiety disorder, we have to study different types of phobia, then somatoform, then conversion disorder, then OCD, that is obsessive conversion disorder, then anxiety, etc. Then in others, I have made a mnemonic, that is dipsalic. For D, that is your dementia. Then for I, that is intelligent disability. Then P, that is your psychological emergency. Then for S, that is substance use disorder or substance use disease. Then your Alzheimer disease, then adolescents or children disorders. These are in short what topics we have to study in major mental illness. Now let us study how to examine a mental impaired patient when he comes in the clinic. What the points should be noted. So I have made a mnemonic, that is from alphabet A to S, that is ABCD up to PQRS. Now let us study in short one by one. For the A, that is attitude. For B, that is behavior. Then concentration or intelligence. Then for eye to eye contact. Then delusion. Delusion means it is a false belief. Then hallucination. Hallucination means it is a perception. It may be auditory, visual, gustatory, etc. Then after that it is your judgment, then intelligence, then his locomotion, then his memory, then his opinion, then his stupor, his speech, rapport. These are all points we have to note while examining the patient of the major mental illness or any mental illness. If we have to examine, we have to note all this point. Now let us study what is schizophrenia. Schizophrenia is a mental impairment of BET, that is the mental impairment of the behavior, emotion, thought, and which decreases his emotional, that is decreases psychological, social, familial, occupational, and personality, and it affects his family as well as himself. And if we give proper antipsychotic medicine, schizophrenia will surely be treated by proper medicine and he can live a very normal and healthy life. Now let us study what are the signs and symptoms of schizophrenia. For the schizophrenia, always try to remember that is United Kingdom mens, UK mens. For UK, that is your unattempted appearance, your unkempt appearance. And for mens, that is your neuroepileptical malignant syndrome. And also this schizophrenia not only affects the male but it affects also the females. So now let's start the signs and symptoms. In the signs and symptoms of the schizophrenia, the patient is hurried and worried. He always thinks to do or not to do. He is in a confusion state. His self-confidence is very much reduced. He has a fear, emotion, then there is no self-confidence, and he's always think mostly for the things which will happen for the future or what will worst will happen of the future. And so this is what all the signs and symptoms of the schizophrenia. Now let us study what are signs. For the signs, I have made a mnemonic, that is dashing. D for delusion, then for A, that is anxiety, then SI, that is your impaired speech, then for H, that is your hallucination, DSHIN for N, that is negative symptom, that is the reduced speech, or then for G, that is a gross catatropic disorder. These are all in short the symptoms or the signs of the schizophrenic patient. Now let us study what are different types of the schizophrenia. Different types of the schizophrenia, I have made a mnemonic, that is pedicure. For P, that is paranoid. For D, that is your disintegrated. For PDC, for C, that is catatonic. Then for U, that is your undifferentiated, and for R, that is your residual. This is all the types of schizophrenia. Now what are the Complication of the schizophrenia. For the complication of schizophrenia, I have prepared a mnemonic that is CASH. For C, that is your catastrophic stupor. Then for A, that is agitative behavior. For S, that is suicidal tendency. And for H, that is homicidal tendency. This is in short in general the topic of the schizophrenia. Now let us study what is the treatment. For the treatment, I have made a mnemonic that is SPECS. S, that is for sedative drugs, where we have already studied, that is the Dokla, that is for diazepam, then clonazepam, etc. Then for S, it is sedative. Then for P, that is antipsychotic medicine. For the antipsychotic medicine, we have made a mnemonic that all people should have a bath, that is your butyrphenol, then aliphatic compound, then piperidine compound, piperazine compound, heterocyclic compound, and a typical psychotic medicine. These are in short I have described, and if you want to know more, you can go in my channel in the YouTube and search for the antipsychotic treatment medicines. Then S for sedative, P for antipsychotic medicine, ECT, that is your electroconvulsive therapy. Then for C, that is your counseling, and for T, that is the treatment of the emergency sign and symptom. For the emergency sign and symptom, we should know that after taking this medicine, many times we can see the EPS syndrome, or we can see that is a neuroepileptic malignant syndrome. And for the EPS syndrome, the main 4 symptoms which we can see in the EPS, that is, for this I have made a mnemonic that is APAT. A, that is your akinesia. For P, that is pseudoparkinsonism. Then for A, that is again acute dystonia. And for T, that is tardive dyskinesia. This is all for the EPS. Now let us study what is neuroepileptic malignant syndrome. For this I have made a mnemonic that the symptoms which we can see, that here, that is FOD. F for fever, O for output of the urine output is reduced, R for rigidity, and D, that is for the D, that is the disorientation. And for the neuroepileptic malignant syndrome, the treatment we should take, that is dantrolene medicine, and we should reduce all the antipsychotic medicine. This is all in short of the schizophrenic different types and the different stages and different treatments. Hope you like this topic of schizophrenia and major mental illness. For more topics and more classification, like and subscribe my channel. Thank you.